The Iowa Clinic Physical Therapy is now offering a new technique called cupping. This innovative technique tackles issues with the myofascial tissue that surrounds your muscles and bones.
Myofascial cupping has been around since 5000 BC, and it started in Greece and China. And they originally used bamboo cups and fire to create a suction effect on tissue to draw out impurities, toxins, pain. And it's basically evolved now to where we use hand pumps and acrylic cups to break up old injuries that scar down in that myofascial layer. Today I'm going to do a myofascial cupping treatment today on your IT band, so it'll be from here to here. And it's because you have pain down at your knee is caused by some restriction in the myofascial network coming up above that. So the first thing I want to do is just feel for the adhesions or where the tight spots are.
Cupping therapy is an ideal treatment option for athletes and those living with chronic pain. Cupping helps ease conditions such as tendinitis, bursitis, plantar fasciitis, postural and chronic neck pain, IT band syndrome, and hip bursitis.
So what myofascial cupping does is it'll break up those bindings in the myofascial tissue so that the patient's pain goes away. How it works is we take an acrylic cup dome and we create a seal with massage cream, and then we use a hand pump to pull the air out of the cup, and it's lying over the tissue. So what happens is when you remove the air, you've got a suction effect and you pull up that tissue. And so you can get the skin and those superficial myofascial layers and then some of the superficial muscular layers in there and actually start to stretch. It's a form of stretching. And I'll leave that on for 1 minute to up to 15 minutes. The second part is where we actually try to now break that adhesion so that it becomes elastic along the line we want it to move, and that's called scraping. So then I take the cup and I'll move it up and down the tissue to release it from all directions. Each treatment lasts 30 to 40 minutes. People usually need 1 to 3 treatments unless they're continuing to do their activity that's building up the trauma again, and it needs to be redone as a tune-up in 3 to 6 months. The last part is having the patient restore that range of motion that they're missing. So if Amy had pain with squatting and bending her knee, so then I would have her bend her knee or maybe possibly squat as I do the treatment until her pain dissipates or until I feel the friction in the tissue or the adhesion go away. This can be used on its own, but I think it works best when you incorporate it with home program of certain stretching and exercises to keep the tissue moving in the way you release it. So you're basically retraining that tissue to become elastic so it doesn't bind back up on you again and cause pain. This is one more tool, and it's a powerful tool that, that helps complement some of those other therapies.
If you're interested in learning more about cupping therapy, call the Iowa Clinic Physical Therapy Department at 875-9706.